Before we begin, consider this. What if one ingredient, hiding in foods you barely question, has been quietly controlling your energy, your mood, your weight, even your long-term health? Sugar doesn't usually feel dangerous. It feels comforting, rewarding, normal. But medically speaking, excess sugar forces your body into a constant biochemical battle, one that most people never realize is happening. Now imagine removing it, not forever, just 14 days. Here's what often surprises my patients. The body begins responding within 24 hours. Blood chemistry shifts, hormones start recalibrating. Your brain, which is heavily influenced by sugar, begins adjusting faster than most expect. As the ancient physician Hippocrates once said, before you heal someone, ask them if they are willing to give up the things that make them sick. Sugar is one of those things. But let me be clear about something important. The first few days are not always comfortable. In fact, many people experience symptoms that feel alarming: headache, irritability, intense cravings, and they assume something is wrong. Medically, it's often the opposite. It can be a sign your metabolism is shifting away from rapid sugar dependence. Think of it like this. If your body has been running on quick-burning fuel for years, removing it is similar to switching a machine onto a more stable power source. There is friction at first, but then comes efficiency. I once had a 42-year-old patient, a busy executive, who told me on day 3, I didn't realize how controlled I was by sugar until my body started asking for it. That awareness alone can be transformative, because what happens next is where biology becomes fascinating. Within the first 48 hours, your body enters a phase many doctors informally call metabolic withdrawal. It sounds dramatic, but understanding it removes fear. And what your brain does during this phase explains why sugar is often compared to an addictive substance. Let's step into that. If you stop eating sugar today, the very first organ to notice is not your stomach. It's your brain. Because sugar strongly stimulates dopamine, the neurotransmitter linked to pleasure, reward, and motivation. Every time you consume something sweet, your brain receives a small signal that says, remember this. We want it again. Over time, the brain adapts to these repeated spikes. So when sugar suddenly disappears, your neurochemistry must recalibrate. This is why the first 72 hours can feel surprisingly intense. Many people report persistent headaches, irritability, sudden fatigue, difficulty concentrating, powerful cravings. Some even describe it as feeling off, without knowing why. Medically, this reaction is predictable. Your body has been relying on fast glucose for immediate energy. Without it, your system begins searching for alternative fuel sources, primarily stored glycogen, and soon after fat. But the brain doesn't enjoy this transition at first. As neuroscientist Dr. Nicole Avena, who studies sugar's effects on the brain, explains, sugar activates the brain in ways similar to certain addictive substances, which is why withdrawal symptoms can occur when intake suddenly stops. Now, here's something important I often tell patients. Withdrawal is not a sign of damage. It is a sign of neurological adjustment. Think of it like lowering loud music that has been playing for years. At first, the silence feels uncomfortable, almost unnatural. Then your hearing resets. Around day 2, another shift begins quietly inside your bloodstream. Insulin levels, the hormone responsible for moving sugar out of your blood, start stabilizing. When insulin spikes less frequently, your energy levels typically stop swinging between highs and crashes. But there is one symptom that catches many people off guard. Your cravings may actually peak after you quit. Not because your body needs sugar, but because your brain remembers how quickly it delivered pleasure. This is the psychological layer of metabolism. However, if you move past this short window, something remarkable begins to happen. By roughly day 3, your body starts improving its ability to access stored fat for energy, a sign of growing metabolic flexibility. And once that switch begins, most people notice their first wave of steady, reliable energy. No spike, no crash, just consistency. But the real turning point, it usually arrives a few days later, when inflammation begins to decline and your body enters a noticeably calmer internal state. Let's talk about that next. By the time you approach the end of your first week, most of the neurological turbulence begins to settle. This is the phase where many patients look at me and say, "Doctor, I feel strangely stable." And biologically, that makes perfect sense. One of the biggest internal changes happening now is a reduction in systemic inflammation. Excess sugar promotes inflammatory activity in the body, not the kind you see after an injury, but the silent, cellular type linked to fatigue, joint discomfort, skin issues, and long-term disease risk. When sugar intake drops, your immune system no longer has to remain on constant alert. Think of it like lowering background noise that you didn't even realize was there. Suddenly, your internal environment becomes quieter. Around this time, another powerful shift often begins. Energy stops fluctuating. Instead of riding the familiar roller coaster, quick boost, sudden crash, craving, repeat, your cells start producing energy at a more controlled pace. This is metabolic efficiency. As Thomas Edison once said, the doctor of the future will give no medicine, but will interest patients in the care of the human frame. Reducing sugar is exactly that, caring for the human frame. Now let me give you a real-world example. A 35-year-old teacher once told me that by day 6, something unexpected happened. I didn't need my afternoon coffee anymore, I just wasn't crashing. That afternoon crash is often the byproduct of blood sugar volatility. And when stability returns, so does mental clarity. Perhaps the most visible early change appears in the mirror. Many people notice reduced facial puffiness or mild bloating. This is not dramatic fat loss. It is largely water balance correcting itself. Sugar encourages the body to retain more water. When intake falls, the body releases the excess fluid. Result, you may look slightly leaner, even before true fat adaptation accelerates. However, do not assume the biggest benefits have already arrived, because what starts happening in the second week is where physicians become especially interested. Your body begins improving something strongly associated with longevity, insulin sensitivity. And once that improves, your risk profile for several metabolic conditions can begin shifting in the right direction. Let's step into that phase next. By the second week, your body is no longer resisting the absence of sugar. It is adapting to it. And adaptation is where real protection begins. One of the most important medical changes happening now is improved insulin sensitivity. In simple terms, your cells become better listeners. When insulin signals them to absorb glucose, they respond efficiently instead of resisting. This keeps excess sugar from lingering in your bloodstream, where over time it can damage blood vessels and nerves. As physician Dr. Elliot Jocelyn, a pioneer in metabolic health, once said, "The person with diabetes who knows the most lives the longest." Understanding how sugar affects your body is part of that knowledge. Now here is something fascinating I often explain to patients. When insulin functions smoothly, your body is less likely to store energy as fat, and more likely to use it productively. But the benefits aren't just internal anymore. Around days 8 to 10, many people report a surprising mental shift. Cravings begin to weaken, not vanish completely, but lose their authority. Foods that once felt irresistible start becoming optional. This is not just discipline. It is neurological rewiring. Your brain's reward pathways are learning that constant sugar is no longer guaranteed, and they begin seeking satisfaction from more stable sources of energy. Let me share a quick clinical observation. A 50-year-old patient once told me on day 9, "For the first time in years, I walked past the dessert table and to even argue with myself." That internal silence is powerful. Because decision fatigue, the constant negotiation with cravings, drains mental energy. When it fades, focus often improves. But there is another change happening quietly that doctors pay very close attention to: your liver. Excess sugar, especially fructose, places a heavy processing burden on this organ. With intake reduced, the liver finally gets breathing room, allowing fat accumulation inside liver cells to gradually decline. Think of it as lifting weight off a machine that has been overworked for years. However, the most visible transformation for many people is about to begin, and it tends to arrive near the end of the second week, because this is when your body becomes noticeably more efficient at burning stored fat. Let's talk about that next. By now, something very important has happened. Your body has stopped asking, "Where is the sugar?" and started asking, "What else can we use for fuel?" This is the moment physicians often refer to as metabolic flexibility. Your body ability to smoothly switch between fuel sources instead of depending on constant sugar intake. And when that flexibility improves, fat oxidation begins accelerating. In simple terms, your body becomes better at unlocking stored fat and converting it into usable energy, not overnight, not magically, but measurably. Many people notice their clothes fitting slightly differently around this phase, even if the scale hasn't dramatically changed. Remember, the scale measures weight. your metabolism measures efficiency. As the legendary physician Hippocrates warned centuries ago, diseases do not come upon us suddenly. They develop from small daily sins against nature. Reducing sugar is one way of correcting those small daily stresses. Now here's a change that surprises even high-performing professionals. Mental clarity often sharpens. Patients frequently describe it as my brain feels quieter. Less fog, fewer abrupt energy dips, more sustained concentration. Why does this happen? Because without repeated sugar spikes, your brain receives a steadier flow of energy instead of chaotic bursts, followed by crashes. Stable fuel supports stable thinking. But there is another biological advantage emerging now, one that cardiologists find particularly encouraging. Triglyceride levels may begin trending downward. Triglycerides are a type of fat circulating in your blood, and elevated levels are strongly associated with cardiovascular risk. When sugar consumption drops, the liver often produces fewer of these fats. It is a quiet but meaningful shift toward long-term protection. However, do not mistake this phase for the final destination, because the 14th day is where many people experience the realization that changes are no longer temporary. They are becoming physiological. And what your body builds by that point can influence your health trajectory for years. Let's step into the final stage. By day 14, your body is no longer reacting. It is operating differently. What began as a simple dietary decision has now triggered a cascade of protective adaptation. Your blood sugar is likely more stable. Energy is more predictable. Cravings have less control. Your metabolism responds with greater intelligence. But if I had to summarize the medical significance of this moment in one phrase, it would be this: you have reduced metabolic stress. And that matters more than most people realize. Chronic metabolic stress is one of the silent drivers behind conditions physicians work tirelessly to prevent: cardiovascular disease, insulin resistance, and long-term inflammatory disorders. When that burden decreases, your body reallocates resources toward repair, instead of constant damage control. As Dr. Mark Hyman famously said, food is not just calories, it is information. It talks to your DNA and tells it what to do. For 2 weeks, you've been sending your biology a very different message. Now here is something I always remind patients: the goal was never perfection. It was awareness. Because once you experience how different your body can feel, you stop viewing sugar as harmless background noise. You begin seeing it as a lever, something you can consciously control. Let me leave you with a clinical truth that doctors quietly agree on: most transformative health changes do not come from extreme intervention. They come from removing what quietly harms you again and again. So if these 14 days taught you anything, let it be this: your body is remarkably forgiving when you finally give it the conditions it was designed for. The real question now isn't, can you quit sugar? It's this: now that you know how your body responds, why would you go back to unconscious habits? Because protecting your future health is rarely about dramatic moments. It is about small decisions repeated daily. And sometimes the most powerful medical upgrade begins simply by changing what's on your plate.